In the shadow of the Great Pyramids, ancient Egyptian physicians pioneered surgical techniques that would influence medicine for millennia to come. Their sophisticated understanding of the human body and the tools they developed tell a remarkable story of innovation and healing. The Edwin Smith Papyrus, dating back to 1600 BCE, reveals a world of surprisingly advanced medical procedures. Within its ancient pages, we find detailed descriptions of surgical tools that would not seem entirely out of place in a modern operating room. Bronze scalpels, shaped with precise edges for delicate incisions. Hooks and forceps, carefully crafted to manipulate tissue and close wounds. Even specialized suture needles, designed to close injuries with remarkable precision. These weren't mere craftsmen's tools, but instruments developed through careful observation and practical experience. Egyptian surgeons used copper needles to suture wounds, applying honey as a natural antiseptic. They fashioned small knives from obsidian, creating edges sharper than modern surgical steel. Their bone saws and drills, though primitive by today's standards, allowed them to perform complex procedures, including the treatment of skull fractures. But perhaps most remarkable was their systematic approach to surgery. The Edwin Smith Papyrus describes 48 cases of trauma and their treatments, each following a methodical pattern: examination, diagnosis, treatment, and prognosis. This clinical approach mirrors modern medical practice, showing how these ancient healers laid the groundwork for scientific medicine. Egyptian surgeons also understood the importance of cleanliness, using alcohol and honey to prevent infection. They developed specialized tools for embalming that would later influence surgical instrument design. Their understanding of human anatomy, gained through the mummification process, informed their surgical procedures and tool development. Today, when a surgeon picks up a scalpel or forceps, they're holding instruments whose basic designs were conceived over 3,000 years ago in the fertile valley of the Nile. While modern surgery has evolved dramatically, these ancient Egyptian innovations continue to influence medical practice, reminding us that the roots of modern medicine reach deep into humanity's past.